Have you ever, like, stared at a medical bill? Or maybe one of those explanation of benefits things from your insurer and felt like you needed, I don't know, a translator?
Like a Rosetta Stone for healthcare.
Exactly. Or, okay, have you tried comparing health plans, say, during open enrollment and just felt totally overwhelmed by all the jargon, the
Yeah,
numbers?
and you just want to throw your hands up.
Right. You're definitely not alone in that. It's super common. And honestly, figuring out healthcare costs can feel like you need like a PhD in finance, maybe law.
And a crystal ball wouldn't hurt either.
Yeah, just to understand what you're actually paying and, why. So today on the deep dive, we are pulling back that curtain. We're looking at one of the most vital, but yeah, often the most bewildering parts of U.S. health insurance, out-of-pocket costs.
Right.
And this isn't just, abstract numbers. This is about your money, your financial security, your peace of mind, really, and, well, your ability to get the care you need without all that stress and those nasty surprises.
Yeah. Absolutely. We're here to give you that shortcut to clarity. That's exactly right. And for this deep dive, we've really gathered some great stuff. We've got comprehensive guides that break down the jargon, and we've pulled info straight from the source, authoritative sites like healthcare.gov, CMS is the Centers for Medicare and Medicaid Services.
Right. Yes, yeah.
And also the Kaiser Family Foundation, KFF. Everyone knows KFF. These are really solid, trusted resources. They're the backbone for our discussion today, letting us really unpack what out-of-pocket truly means for you, the individual, navigating this sometimes pretty daunting landscape.
Yeah, daunting's a good word for it. So our mission today, it's pretty straightforward, but I think really powerful.
Right.
We want to turn that confusion into clarity, real understanding. We want to give you the knowledge to, confidently navigate your plan, budget for those costs, expected and unexpected, and just fundamentally get where your money's going when it comes to health. Because let's face it, when it's your health and especially your finances, clarity isn't just nice. It's everything. Clarity is king.
Well said.
Okay, so let's dive in. Let's pull back this curtain. Imagine, like, trying to put together a really complex puzzle, right? But half the pieces are written in this weird medical financial code.
Yeah, that's a good analogy.
That's often what understanding out-of-pocket costs feels like. So in this big, often confusing world of U.S. health insurance talk, out-of-pocket costs are basically the dollars that you, the patient, have to pay directly for covered medical care
Right.
during your plan year.
Right. Directly.
And here's the first key thing. This is on top of your monthly premium. The fee you pay just to have the insurance.
That premium is just the entry fee, basically.
Exactly. So think of these out-of-pocket costs as your personal share. It's called cost sharing, right? It's the part of the bill you cover, along with your insurer, but only for services your plan actually covers. It's your contribution once you're in the door.
And there's an important piece here, a really vital layer of protection that honestly a lot of people might not be fully aware of.
Oh, what's that?
It's a federal safeguard. The Affordable Care Act, the ACA, it actually puts a hard cap, a limit, on how high those out-of-pocket costs can go each year. This applies to most job-based plans and the marketplace plans.
Okay, a cap. That sounds important.
Absolutely critical. It's consumer protection. It means there's a ceiling, right? A finite limit to how much you could possibly have to pay for covered services in a year. It stops medical debt from just spiraling infinitely if something really bad happens.
Wow, okay. That's huge.
It is. But, and this is where it gets a bit tricky, as our sources from CMS and KFF point out, how you pay that money towards the cap isn't just one simple payment. It's spread across several moving parts that kind of work together. It's more of a dynamic system than just one number.
Ah, okay. So not just one single figure I need to worry about hitting. It's like different components.
Exactly.
It's a
So
system.
that's a really key point.
Yeah.
Because, it's not static. It's dynamic. Things interact, sometimes in ways that can catch you off guard if you're not ready.
So our goal here is to break down each of those components one by one, explain how they interact, and maybe most importantly, clarify what counts, what does count towards that annual out-of-pocket maximum, and just as critically, what doesn't.
Right. The exclusions are key.
Absolutely. Understanding that difference isn't just about knowing definitions. It's really key to managing your healthcare finances and avoiding those horrible surprise bills.
Wow.
So where do we start this journey? Let's begin with the foundation, the cornerstone, the deductible.
The big one, usually.
Yeah, you probably know the term. It's that amount you pay up front, right, for covered services before your plan starts paying anything significant. One of our sources uses a great analogy. I thought this was really helpful. Think of it like a meter. Starts at 0 at the beginning of your plan year.
Okay, a meter. I like that.
And that meter just keeps running, adding up your costs for covered stuff until you hit that specific deductible number for your plan. Once you hit it, then your insurance really starts kicking in for most things.
Got it.
Now, there's a huge exception here, and it's crucial for, staying healthy: preventive care.
Ah, yes, preventive. Very important.
In most plans, things like your annual physical, certain cancer screenings, mammograms, colonoscopies, flu shots, stuff like that, it's usually covered 100%, totally free to you, even before you paid a single penny towards your deductible.
Which is a huge incentive to actually get those screenings done. Don't wait.
Exactly. It removes that financial barrier.
Okay, so connecting that deductible to the bigger picture, knowing the typical ranges for deductibles is really essential. It helps you gauge your potential upfront costs, right? It helps you budget.
Makes sense. What are we talking about range-wise?
Well, for 2025 marketplace plans, the difference can be really stark. It depends heavily on the plan tier: bronze, silver, gold, platinum.
Right, the metal levels.
Exactly. So for bronze plans, or those high deductible health plans, HDHPs, the individual deductible could be anywhere from, say, $2,000 all the way up to $9,100.
Wow, $9,100. That's a lot up front.
It's a very substantial amount you might have to pay before your insurer starts sharing the cost significantly. But then you look at the other end, the gold or platinum plans, those richer plans with higher premiums. They might have deductibles as low as $0, or maybe capping out around $1,500.
0. Okay, that's a big difference.
A huge difference, and it directly impacts how much you might pay out of pocket before insurance really helps with non-preventive care. So it's a critical factor when you're choosing a plan, especially if you think you'll need regular doctor visits or treatments.
Okay, now here's something potent. A detail that could really save you a lot of money, maybe heartache. And it's something lots of people miss.
Okay, what is it?
Only allowed charges for covered services actually count toward meeting your deductible.
Allowed charges for covered services.
Right.
That phrasing is key.
It sounds bureaucratic, but the impact is massive. What does it mean for you? Well, say you decide to pay full price, cash, to an out-of-network plastic surgeon for something cosmetic, something elective. That money, even if it's thousands of dollars, does not move your deductible meter. Not one bit.
Because it's not a covered service, or it's out of network, or both.
Exactly. It's like a totally separate financial bucket.
Yeah.
You're responsible, and it has 0 impact on reaching your plan's deductible or out-of-pocket limits.
It's just gone from the perspective of your insurance plan's limits.
Right. So you've probably seen people wrestling with this. When it comes to checking if a service is covered and allowed before you get the care, what's the biggest mistake people tend to make?
That is a fantastic question, and it points to a really common pitfall. Based on our sources, and just anecdotally, people often assume things. They assume if their doctor recommends it, it must be covered.
Yeah, seems logical.
Or they assume if they go to an in-network hospital, everything done there will be in-network and covered.
The facility versus the provider issue.
Exactly. They often don't realize the responsibility is usually on them, the patient, to proactively check. You need to verify with both your doctor and your insurance company that the specific service is covered under your plan's rules, and that the provider is in network and the charge is allowed.
That sounds like a lot of homework before you even get sick.
It can be. And this lack of, let's say, diligence or just understanding, it can lead to really significant bills that tragically don't even count towards your deductible or your out-of-pocket cap. You think you're making progress towards that safety net, but you're actually just spending money on things that don't qualify. It's a major gap in consumer awareness.
Okay, moving on. Next up, the copayment. Or, just copay.
The copay.
This one's usually simpler. It's a flat dollar fee, right? You pay it each time you get a specific service or fill a prescription.
Right. Fixed amount.
So it might be, say, $35 for a primary care visit, or $10 for a generic drug refill, maybe $75 for urgent care. The key is it's fixed, predictable. You know what you'll pay up front for that specific thing.
Which can make budgeting for routine stuff a bit easier.
Yeah, definitely.
Now, a key difference here, again, is how these copays interact with your deductible. It's not the same for all plans.
Okay, how so?
For those richer plans we talked about, gold, platinum copays often apply immediately, even before you've met your deductible. For routine stuff like doctor visits or common prescriptions.
So you get that predictable cost right away.
Exactly. Predictable, smaller costs from day one, which is nice. But for the high deductible plans, the HDHPs, Copays generally don't apply until after you've met that big deductible.
Okay, so on an HDHP, I might pay the full allowed charge for a doctor's visit until my deductible is met, and then maybe a copay applies later.
That's often how it works. It's a critical difference when choosing a plan. It dictates your upfront spending for everyday care, a really important nuance.
Got it. And here's another point people might miss. Every single copay you pay, whether it's before you hit the deductible or after it does get added to your running total for the year, towards that out-of-pocket maximum.
Right. Every dollar counts towards the OPM.
So even though they feel small, $10 here, $35 there, they're constantly adding up, like drops in a bucket, slowly filling it towards that maximum limit.
Precisely. They contribute steadily.
Okay, so we've got the deductible, pay first, then maybe copays, flat fees, sometimes immediate, sometimes after deductible. What's next?
Coinsurance.
Coinsurance, right. This one usually kicks in after the deductible is met, doesn't it?
Typically, yes. Once you've paid your deductible amount, coinsurance often starts.
And this isn't a flat fee like a copay. This is a percentage, right? A percentage of the allowed charge.
Exactly. A percentage. So if your plan has 20% coinsurance and you have an MRI with an allowed charge of $1,000 after meeting your deductible.
Then I'd pay 20% of that $1,000, which is $200.
Correct. The insurer pays the other 80%, or $800 in that case.
And our sources say coinsurance usually applies to the more expensive stuff, right? Like imaging, surgery, hospital stays.
That's generally true. It's often tied to higher cost services. Things like advanced imaging, outpatient procedures, inpatient hospital care, maybe specialty drugs.
Okay.
And because it is a percentage, coinsurance can feel a lot more, well, costly, especially when you're using expensive services.
Yeah, 20% of a small number is small, but 20% of a huge number.
Right. 20% of a, say, $10,000 surgery bill is $2,000. That's a significant amount you owe.
Mm-hmm.
And this really brings up that challenge of transparency again. How easy is it, really, for you, the patient, to find out the plan's allowed amount for a big procedure before you have it done?
Probably not very easy sometimes.
Our sources, KFF especially, suggest that knowing this figure in advance can help avert sticker shock.
Avert sticker shock. That phrasing implies it happens a lot.
It certainly implies that unexpected high coinsurance bills are a common and, frankly, distressing problem for many people. It just highlights how hard it can be to predict your exact share, especially for complex stuff where that percentage means real money.
Yeah. Let's make that crystal clear. Imagine that surgery again. Allowed charge, $10,000. You've made your deductible. You have 20% coinsurance. You are personally on the hook for $2,000.
Mm-hmm.
That's a big chunk of change right out of your pocket.
Mm-hmm.
It really underscores why you need to understand that coinsurance percentage in your specific plan. It's not just some number in the fine print. It's a direct hit to your savings, your budget. Got to factor it in when choosing.
Absolutely critical to understand.
Okay, so deductible, copays, coinsurance. It sounds like a lot of numbers adding up.
Mm-hmm.
And potentially scary numbers.
It can feel that way.
But wait, there's a safety net, right? The ultimate backstop.
Yes, thankfully. The out-of-pocket maximum, or OPM, as it's often abbreviated.
OPM. Okay, explain that.
This is the absolute hard ceiling. It's the maximum combined total you will pay for your deductible, all your copays, and all your coinsurance for covered in-network services within one plan year.
The absolute maximum.
The absolute maximum for those specific costs. And here's the really fantastic part, the part that brings peace of mind. Once you hit that OPM cap,
your insurer must pay 100% of any additional covered in-network charges for the rest of that plan year.
100%. So my financial responsibility for covered care just stops.
It stops. For covered in-network care for that year, it's your ultimate financial shield against potentially astronomical medical bills from a major illness or injury.
Wow. Okay, that is a serious safety net.
It really is. And from a bigger perspective, these regulatory caps are just crucial for financial planning, especially if you have chronic conditions or just want protection against the unknown.
So what are the caps? You mentioned the ACA sets them.
Yes. For 2025 ACA-compliant plans, the federal limits are set at $9,200 for an individual plan.
$19,200 for one person.
Right, and $18,400 for a family plan.
$18,400 for a family. Oh.
And interestingly, these are actually down slightly from 2024. In 2024, it was $9,450 and $18,900.
Oh, they went down. That's unusual. A slight decrease, yes. But it provides that clear, federally set benchmark. You know your absolute maximum exposure for covered in-network care won't exceed those amounts for the year. You can budget for the worst-case scenario.
That helps. Does that apply to all plans? Like Medicare.
Good question. No, other plan types can have different ceilings. Medicare Advantage plans, for example, have their own limits, which are often lower. For 2024, the MA cap for in-network Part A and B services was $8,850.
Okay, so still important to check your specific plan type.
Always. The rules can vary. These ACA caps apply broadly to Marketplace and many employer plans, but not universally to all types of coverage.
Got it.
And this really brings up, a crucial point. How many people actually know this hard ceiling exists?
Good question. Probably not enough.
The OPM is designed precisely for those catastrophic situations, right? The really expensive stuff. Major surgery, cancer treatment, a serious accident. Without it, bills could just climb forever. Understanding this limit isn't just theoretical budgeting. It provides real, practical financial security, a tangible sense of, okay, even if the worst happens, my financial liability for covered care has a defined end. It's a huge pillar of consumer protection.
Yeah, knowing there's a limit, even if it's high, is way better than thinking it's infinite.
Absolutely.
Now, you mentioned things can get tricky. Are there other wrinkles with this OPM?
There can be. One thing some listeners might see in their plan details is something called separate sublimits.
Sublimits, like mini maximums within the maximum.
Kind of, yeah. So you might see a separate OPM specifically for, say, prescription drugs, or maybe one for mental health services.
Okay, so I could hit my pharmacy maximum before I hit my overall maximum.
Potentially, yes. But here's the good news, and this comes straight from CMS. Even if your plan has these sublimits, the total amount you pay across all those categories combined still cannot exceed that main overall federal OOPM ceiling.
Okay, so they can slice it up, but the total cap remains the same.
Exactly. The ultimate safety net, that $9,200 or $18,400 for 2025, stays intact. It's like having budget categories for groceries and rent, but still having an overall monthly spending limit you can't go over, no matter how you allocate the funds within those categories.
That makes sense. Good to know the overall cap holds firm. Okay, this next part feels really important. You mentioned things that don't count towards that OPM.
Yes, the exclusions. Critically important.
Because this is where people can really get caught out, right? Yeah. They're just chipping away at their max, but they're spending money that doesn't count at all.
Precisely. These are the costs that fall outside that protective umbrella. Understanding these is just as vital, maybe even more so, than understanding what does count. These are the financial blind spots.
All right, lay them out for us. What doesn't count?
Okay, first and foremost, and this is a big one, your monthly premiums.
The money you pay just to have the insurance.
Exactly. That's the subscription fee, the price of admission. It's not cost sharing for services you use, so premiums never count towards your OPM, ever.
Okay, premiums are out. What else?
Second, and this trips up so many people, out-of-network balance billing.
The dreaded surprise bill.
Yes. So imagine you go to an in-network hospital, but maybe the anesthesiologist or a lab they used was actually out-of-network for your plan.
Sneaky.
It happens. If that out-of-network provider then bills you for the difference between their full charge and what your insurance paid that's balance billing, those amounts typically do not count towards your in-network OOPM.
Wow. So I could pay a huge out-of-network bill, and it doesn't help me reach my main safety net.
Generally, no. The ACA doesn't require plans to count it towards the in-network OOPM. Some might, but most don't. It's a huge financial risk if you unknowingly go out of network, even within an in-network facility sometimes. Really underscores why you have to check the network status of every provider.
Okay, that's a big warning sign. What's number 3?
Third, services the plan simply doesn't cover at all.
Like elective cosmetic surgery.
That's the classic example. Or maybe a service considered experimental or something specifically excluded in your plan documents. If it's not a covered benefit under your plan or the ACA's essential health benefits, then 100% of that cost is yours, period. And because it's not covered, it never helps you reach your OPM. You're just paying for it entirely separately.
Got it. Non-covered means non-covered and doesn't count.
Right. And finally, number 4, penalties for failing to get prior authorization.
Prior auth. Yeah. Plans love that.
Many plans require you to get approval before you get certain services, especially expensive ones like MRIs or surgeries. If you don't get that required prior auth, and the plan imposes a penalty like making you pay an extra $500 or maybe covering less of the cost, that penalty amount is usually considered administrative. It's not cost sharing for the medical service itself, so it typically doesn't count towards your OPM.
So skipping the paperwork can cost you extra money that doesn't even help you reach the cap.
Exactly. Double whammy.
Okay, so let's boil this down. What's the bottom line impact of these exclusions on my wallet?
The bottom line is you could be spending thousands of dollars on things related to healthcare premiums, out-of-network bills, non-covered treatments, penalties. But if they fall into these excluded categories,
Uh-huh.
it's like throwing money down a well when it comes to hitting that OOPM safety net. None of it brings you closer to the cap. You're still fully on the hook for those costs, plus whatever you need to spend to actually reach your OOPM through covered in-network services.
That's sobering. Really highlights the need to understand the rules.
It really does. And this brings up a crucial point about terminology. The specific words your plan uses and how they affect your finances.
Okay.
Our sources, like CMS, are very clear. There's a huge difference between a service being non-covered versus being covered but subject to cost sharing.
Explain that difference. It sounds subtle but important.
It's vital. If a service is truly non-covered, like we said, 100% of the cost is yours, forever. It will never help you reach your OPM. It's outside the plan's protection entirely. A financial dead end from an OPM perspective.
Okay. Non-covered, no help towards the cap.
Right. But if a service is covered by your plan, it's just subject to your cost sharing, meaning your deductible applies or you owe a copay or coinsurance.
Yeah.
Then the money you pay for that service does count. It builds towards your OPM until you hit the ceiling.
Ah, so covered services, even if I have to pay a deductible or coinsurance, do chip away at the maximum.
Exactly. That distinction is absolutely critical for managing your costs. One path leads towards the safety net. The other leaves you completely exposed for that specific expense. Understanding the fine print here can literally save you thousands.
That's such a great point. It's like the difference between paying for a taxi versus buying a car.
Oh, okay. How so?
Well, paying the taxi fare counts towards your daily travel budget limit, right? But buying a whole new car, that's a totally separate massive expense. It doesn't count towards your daily commute budget limit at all.
That's a perfect analogy. Different buckets of money, different rules, different limits.
Exactly. Knowing which bucket your healthcare costs fall into is just paramount for smart financial planning. You got to know if it counts towards that limit or not.
Okay, theory is great, but let's make this real. Let's walk through a case study, a hypothetical patient in 2025. Let's see how these moving parts actually work together over a year.
Good idea. Concrete examples help a lot.
All right, so let's say our patient has a plan with a $1,000 deductible, pretty low, and 20% coinsurance after that, standard copays for visits, and that 2025 individual OPM of $9,200.
All right, dog-key deductible, 20% coinsurance, $9,200 OPM.
Got it. So January. Patient gets sick, goes to the primary care doc. The allowed charge is $150. Their plan has a $35 copay for this. What happens? Okay, since copays often apply before the deductible on some plans, let's assume this one does for primary care, they pay the $35 copay.
Right, so their out-of-pocket tally for the year starts at $35. That meter is running.
$35 towards the $9,200 max.
Okay, fast forward to March. Knee pain. Needs an outpatient MRI. The allowed charge is $1,000.
All right, they haven't met their $1,000 deductible yet. They've only paid a $35 copay. So for this $1,000 MRI,
They pay the whole thing.
they pay the full $1,000 allowed charge, and boom, that meets their deductible exactly.
Okay, so their OOP tally jumps from $35 to $1,035, and the deductible's now met.
Correct. Deductible satisfied. That was a big chunk up front.
April. Follow-up visit with a specialist about the knee MRI. Allowed charge is $180. Let's say the specialist copay is $50.
Okay, deductible is met, copay applies, they pay the $50 copay.
So the OOP tally goes up by $50 to $1,085. Even after the deductible, those copays keep adding up.
Yep, still chipping away towards the max.
June. Needs arthroscopic knee surgery. Higher cost item. Allowed charge is $8,000.
Okay, deductible is met, $1,000 paid. Now, coinsurance kicks in. They owe 20% of this $8,000 allowed charge.
20% of $8,000. That's $1,600.
Correct. They pay $1,600 in coinsurance for the surgery.
So add that to the tally. $1,085 plus $1,600. That's $2,685 total out of pocket so far.
Right. That coinsurance on the surgery made a big jump in their total.
Okay, last step. October. Recovery time. Needs 10 physical therapy visits. The total allowed charge for all 10 visits is $2,000.
Deductibles met. Coinsurance applies 20% of $2,000.
That's $400.
They pay $400 in coinsurance for the PT.
All right, final tally for the year. $2,685 plus $400, that's $3,085 out of pocket.
$3,085.
So after the sick visit, an MRI, a specialist visit, surgery, and 10 PT sessions,
Yeah.
they spend just over $3,000.
Exactly. And what does this illustrate? Even with pretty significant healthcare use.
Yeah, that wasn't a cheap year.
Their total out-of-pocket cost of $3,085 is still way, way below that 2025 individual OPM of $9,200.
Way below, like $6,000 below.
Right. It really shows the protective power of that OPM. If, God forbid, something truly catastrophic happened later that year, pushing costs much higher, once they hit that $9,200 mark for covered in-network services, the insurer picks up 100% after that.
It really is a backstop. Shows that even a relatively expensive year doesn't necessarily mean hitting the maximum.
Precisely. It provides that crucial ceiling.
Okay. Beyond those basics, our sources mention some special wrinkles, nuances that can affect costs, things to watch out for.
Yes, there are definitely some important details, especially when choosing or using certain types of plans.
Like what?
Well, one area is those high-deductible health plans, HDHPs, especially when paired with health savings accounts, HSAs.
Okay, HDHPs and HSAs, we hear those terms a lot.
HDHPs often have slightly different OOPM rules. The federal caps for HDHP-compatible plans are usually a bit lower than the standard ACA caps we mentioned. Maybe $1,000 or $2,000 lower for 2025. Those specific numbers are announced each drop.
Lower OPMs on HDHPs. That seems counterintuitive with a high deductible. Why would someone choose that?
It's a strategic trade-off, often. Someone might choose it if they're generally healthy and don't expect high costs, aiming to save money via the HSA. But it also means if they do have high costs, they hit that 100% coverage level sooner because the OOPM is lower.
Ah, okay. And the HSA connection is key, right?
Absolutely. This is where it gets really interesting and beneficial. HDHPs are usually the only plans that let you contribute to a health savings account and HSA.
And HSAs are powerhead.
Hugely powerful. They have a triple tax advantage. Money goes in tax-free, either deductible or pre-tax payroll. It grows tax-free. And withdrawals are completely tax-free if used for qualified medical expenses.
Qualified medical expenses like deductibles, copays, coinsurance.
Exactly. You can use that tax-free HSA money to pay for pretty much all your out-of-pocket costs. It's an incredibly efficient way to save and pay for healthcare, like getting a discount on all your medical bills equal to your tax rate.
Wow. So the HDHP HSA combo uses tax savings to help manage those higher initial costs.
Precisely. It's a very popular strategy for those who can manage the higher deductible exposure.
Okay, what other wrinkles? You mentioned families.
Yes, family coverage has a fascinating nuance regarding the OPM. It offers extra protection.
Oh, so?
Even if you have a family plan with one big family OPM, like the $18,400 for 2025, each individual person on that family plan also has their own individual OPM limit. And that individual limit is the same as the single person limit, $9,200 for 2025.
Wait, really? So one person can hit their own max even if the whole family hasn't hit the family max?
Exactly. It's a critical protection.
So what happens then if one person hits their $9,200 limit?
Then the plan starts paying 100% for that specific person's covered in-network care for the rest of the year, even if the rest of the family combined hasn't reached the $18,400 family total yet.
That is huge, especially if, like, one child has a chronic condition or needs major treatment.
It's a massive safeguard in those situations. It means that one person's high costs trigger 100% coverage for them much sooner without needing the entire family's spending to hit the aggregate limit first. A really important built-in safety valve.
Good to know. Okay, one more wrinkle. Networks.
Yes, networks. Tiered networks, narrow networks. This is a huge area for potential pitfalls related to out-of-pocket costs.
We touched on out-of-network stuff not counting towards the OPM.
Right, and this needs reinforcing. Our sources, CMS.gov, explicitly states it. Out-of-network cost sharing often does not accrue toward the in-network OPM.
That phrasing, often does not accrue, sounds like a major trap.
It absolutely is. Payments you make to out-of-network doctors or hospitals typically don't count towards that main in-network OPM number you see on your plan summary. Think back to that surprise anesthesiologist bill you pay it, but it likely does nothing to get you closer to your in-network safety net.
Leaving you potentially on the hook for thousands more than you expected.
Precisely. It highlights why asking very direct questions, is this specific doctor in my network? Is this lab in my network? Is the facility in my network? Is paramount, even when you're at an in-network hospital.
So the practical advice here is crystal clear, isn't it? Choose in-network providers, always. If you go outside your network, intentionally or even by accident, those payments probably won't chip away at your main in-network OPM. You could end up paying way, way more out of pocket than you budgeted for, even if you think you've hit your spending limit for the year, just because those costs were in the wrong network bucket. It's a significant financial risk you have to actively manage.
Stay in network whenever possible. It's critical.
Okay, wow. We have covered a lot of ground. Let's try to distill this down, bring it all together. What are the absolute key nuggets of wisdom people should take away from this deep dive?
Good idea. Let's summarize.
First, the core definition. Remember, out-of-pocket is everything you pay for covered stuff, after your premiums, but before your insurer hits that 100% coverage point. It's your share.
Your cost sharing.
Second, the order of payments. Generally goes, meet your deductible first, then copays and coinsurance usually apply. And all those payments deductible, copays, coinsurance, count towards your final out-of-pocket maximum.
Right. That sequence is important. And third, critically, remember those exceptions. What doesn't count? Premiums, out-of-network balance billing, services your plan doesn't cover at all, penalties. Those costs sit outside the OPM safety net. There are extra costs you have to budget for separately.
Don't let those exclusions bite you. Okay, and finally,
Caps.
right, arm yourself with those annual federal limits. For 2025, $9,200 for individuals, $18,400 for families on compliant plans. Knowing those numbers helps you compare plans smartly and, crucially, budget for that worst-case scenario. It gives you that financial ceiling, that peace of mind.
Knowledge empowers you.
Absolutely. We've taken this topic, which, let's be honest, can feel like a dense, complex jungle, and hopefully we've made it much more understandable, more actionable for you. Our goal on the deep dive is always to give you that shortcut, get you well-informed, to hit you with those surprising facts, practical tips, maybe just enough humor to keep you listening even when we're talking health insurance.
Indeed. And remember, knowledge is really only powerful when it's understood and then actually applied. Now that you have this grasp of deductibles, copays, coinsurance, the OPM, and especially what doesn't count, you can engage much more confidently with your plan. You can anticipate costs better, hopefully avoid some nasty financial surprises, and just generally be a more informed, more empowered healthcare consumer. Prepared.
Well said. We have truly unpacked what out-of-pocket means in the sometimes baffling world of U.S. health insurance today. Hopefully demystified a really critical part of your financial life. So now that you have this powerful knowledge, here's a little homework, a challenge. What's one immediate question you have about your specific health plan? About its deductible, its copays, its out-of-pocket maximum?
Look it up.
Yeah, pull out your plan documents. I know maybe they're dusty, but look at your numbers. See how these pieces actually fit together for you. They're a really empowering exercise. Check those details until our next deep dive.